Welcome, everybody. We're going to start building trust in health AI with communication. And I was really psyched to be doing this event. And I've done this topic in a similar way about 17 months ago with one of the speakers was here. Back then, we were focusing on narrative and storytelling. This conversation, though, has changed a lot in 17 months. 17, when we had this conversation 17 months ago, it was, are you doing it? Are you not doing it? How do you communicate basic concepts? Now the conversation is totally different. It's everybody assumes that you know a little bit about technology and that you may be using it personally or you might be using it in your business. The skepticism of is it going to be happening in the future, that's gone. But there is skepticism and it's more complex. And we're going to be bringing on speakers one at a time. I'm going to be, I think as we've had time for everyone to come in, and I don't want to waffle on anymore. I'm going to bring on our first speaker, Marcus.
Hey, how are you doing?
Welcome.
I got ready to say good morning, but it's not morning to you. So just hello, everyone.
It's there's we've got some people it's 8 o'clock at night.
I know.
And but good morning is good to say, and we've spoken before, Marcus, about
Mhm.
communication and trust, and I'm going to repost some of those video clips because I put them on LinkedIn video, but we've never had you in this series before. So I wonder, first of all, if you can introduce yourself. Do you mind?
Well, thank you very much, and thank you for the opportunity, Jose. I'm grateful to be here, participating in this event along with Claire and Kofi and Sarah. A little bit about me. My background is in healthcare. I've been in healthcare administration for over 30 years, and I've had a range of experiences there. But the thread throughout it all has been around strategy, marketing, and communications and brand. And what I've learned over the time, including some time in operations, is how all those feed together. Because ultimately, in the brand, and Kofi, as a brand expert there, the brand sensei, is really going to be about the experience that one has with a product or service. And I think that we'll come around to that into the trust part of it very quickly. So, well, that's my background. Currently, I'm a consultant. I'm also an advisor and also a teacher. I'm starting this fall, kicking off another course in healthcare marketing for Masters of Health Administration students at Virginia Commonwealth University. So, thank you again for the time.
It's interesting. And I was actually at a meeting today with somebody about, oh, should we have AI in the title? And I think we're kind of nearing the point where it's not healthcare AI; it's just going to be healthcare.
Mhm.
And but we're having conversations about AI in healthcare, and I know I broached this with you just before we started, where people have skepticism, and it's very complex, more complex than it was. I mean, when I actually started, I've been doing these events for about 2.5 years. 2.5 years ago, is it data secure? Are you following HIPAA? Are you following GDPR? Um, we're way past that now, and a lot of it comes down is questions of do you what do I say to my users if I'm using your product, and what do I say um, to my stakeholders? Do you speak our language? Do you understand where we're coming from? And people are coming to these early conversations with more baggage than they did a year and a half ago. And um, it's really difficult. And I'm very sympathetic because people like to beat up on engineers in healthcare. But when they're coming to the table and they're talking to people in healthcare, or they're talking to clinicians, or they're talking to patients, or it's very difficult for them to understand their counterparties. and what their concerns are. And I wonder if you could speak to that. How do you communicate to people who's somebody who's sitting across the table from you? They're skeptical, and you don't understand their skepticism.
Understand their skepticism.
Yeah, you don't understand what it is
Hmm.
that they're skeptical about. They
Well,
You don't understand if it's because they've heard something on the news or they've had a personal experience now. Um, they maybe they're frustrated because you're assuming they don't know anything, and they actually do know quite a bit. Um, it's a lot more complicated now
mhm,
than it was
mhm.
15 months ago.
Well, look, Jose, we all come to conversations with a bias. I already have a confirmation bias that is pre-wired in each of us, and also motivated reasoning for why we're reaching out and using AI for a particular reason. And so you have to understand that all of us come with a complex predisposition that we have to realize and understand. So if there's skepticism, it might have been borne out not necessarily in listening to a conversation, but it is in the actual experience. And that experience may have produced a result that, based on your bias, you didn't trust. Or opposite, it actually confirmed what your motivated reasoning for engaging in the first place and affirmed it. So it's something to think about more than just the outputs, is looking at the individual and how they're reacting to them.
And you know, I'm going to be asking everybody this question, so I hope it doesn't sound repetitive. Um, what do I say to people? What do I say to people who ask me questions about your technology, about your product, about your service? And what language can you give me that I can pass on to other people that doesn't sound like it was written by a lawyer? That's something that I could use in a patient conversation, something I can use um, in a healthcare context. This is something that a lot of the time I'm hearing about it more and more often from people in healthcare. What do I say to my patients? What kind of tools are you going to give me? And there's a rising expectation that should be included in the product and service. That should be part of it. Does that make sense?
So, so I'm taking the role then as a healthcare provider, encountering you as a patient, and I'm looking for ways to provide information in a conversation that assures you of the product and helps build trust. That's what you're
Yeah.
that's what you're proposing here. And again, I think first there's a trust that has to be built between the provider and the patient or the person in front of them. Assuming that's already existing, then it's more of providing two things. One is sort of more of a left brain answer of how this particular technology has been used and tested and what the results have been. And then there's a more right brain, which is it's here to help you understand better the current circumstances that you have. And it is reliable in the sense that it is another input for you to have to consider as you're going through your healthcare journey. So I think it needs at this juncture both a combination of things that are results driven and outcome driven, and then at the same time it needs to be something that assures them that this is just another piece of information that you have that we have together as your caregiver to help us navigate through your journey.
Is this something that tech companies should be doing? Should they be giving communications material instructions to their customers or their partners in healthcare? Is that, or is this something that they should be reluctant? Should that be a space they'd be reluctant to go in?
Well, if I'm a clinician, I want as much information as I can get. In the
And
end, you need to be able, as a clinician, to provide the judgment that, again, the patient is entrusting in you as a provider. So I think you would want to have as much source information as you possibly can.
and the there's something actually Amy Zolito, our closing speaker, said that nothing changes in healthcare without a story. And if you want your story to change things in healthcare, it has to be a narrative that other people can pass along very easily. And this seems to be the sticking point where somebody in healthcare says, "Okay, I sort of get that what you just told me, but I don't know how to pass that along in the way that I talk to people." And I'm not. Whose job is it? Is that a failure in communication from the people providing the product or service, or is that like the clinician doesn't needs to be educated better on how to reframe these things? I know you don't. Maybe putting it as in terms of blame is actually going to. You're not going to want to do that, but who needs to stay when that if there's that kind of gap? How does the tech provider step up to help?
Now I'm switching roles to a tech provider.
Yeah,
So
switch hats.
I don't know. I can't keep switching roles here because again, my depth of background is only limited to me. And so, as I look at some of the chats coming through, some of them are coming from clinicians. And again, for them, they're the ones that have spent time in education and training and gaining the expertise and building that trust with the patients. What they need is as much information that they can possibly have to have that conversation. To what degree does the tech company participate in that? I think is a conversation for them and how they want to have a relationship with the provider. And so I don't know if I answered your question specifically, but I really can't in the sense that it's going to be about the relationships between the individual and the technology.
Thank you, Marcus. Do you mind if I put you off to the side and bring you back in about 35 minutes?
Okay.
Thank you. You did answer the question, by the way. You did
I
answer the
answered
question.
something. Thank you.
And now we're bringing somebody from the tech side. Sarah,
Hello, how are you?
welcome. I'm very well. Sarah's in the UK. So, and she's got a lot of experience straddling the divide between tech companies and the NHS, which is the health service in the United Kingdom. And I want to actually kind of repose the question to you, Sarah. And this is actually, I'm using Angus as an example. He spoke in an after party about 2 webinars ago. What do I tell my patients? And the person who answered the question gave the right, and what Angus said at the actually, he got an answer. And what Angus said is, okay, you've given me the right answer, but that does not help me. I can't go to this patient and say, oh, there's a chain of custody of contracts that have been vetted by our data protection officer, and they've been checked, and the data is, we believe, is secure. That's not the kind of reassurance they're looking for.
No.
So, and this is tricky. It's like, the tech companies, they have legal concerns. They don't want to make certain. They're very uncomfortable to say certain things, but they're increasingly expected to use less legalese language.
Yeah. No. I mean, I can just give a quick overview of my background very quickly.
Yeah, go ahead.
I'll try without digressing. So my background over the last sort of 10 to 15 years has been working with various tech companies, normally in a consultant capacity, and working with likes of the NHS in all varieties, so frontline care, trusts, community, senior care, mental health services, so the whole broad spectrum within the NHS. It is quite a complicated infrastructure in the UK, as I think probably most are. I've also done some work in Canada and the US as well, North Africa. So yeah, it's been, I've sort of dipped my toe in many aspects, and I think the question that you pose, I think it is an issue, and I think if we can equip healthcare teams with the correct pass along narratives, I think the core problem, which is mainly the gap between tech pitching, if you like, and patient practice, becomes smaller. And you've mentioned, you have touched on this, that most tech companies build communication strategies really around risk mitigation and legal compliance, and sort of very high technical specs. When clinicians ask about data security or clinical safety, companies often provide dense legal jargon designed to protect the company and not actually to empower human conversation. So working with the NHS for a long time, you get to see the reality on the ground. And a clinician sitting in an NHS GP practice or hospital clinic only has around 60 to 90 seconds to explain a new digital tool or home test kit to a patient. And if they can't convey why the tool matters and how it keeps patients' data safe in plain language, the chances are they simply won't recommend it. And I think the goal for tech companies must be to translate complex technical and compliance language into kind of smaller, bite-sized, pass-along trust that clinicians feel confident about speaking out loud to patients. Now, you can look at bridging the gap, and I can speak about a few examples because I've worked in quite a few NHS sectors, and look at some real world examples. Now, we could take, for example, digital triage and patient messaging, which is extremely popular and very well used, especially within the UK. Now, the pitfall was, positioning these tools merely as high volume automated messaging systems. And what this does is make clinicians worry about spamming patients and creating clinical risks. Now, my pass along narrative has been and would be shift the focus to timely access and empowering patients. You could frame it as this tool gives your patients a direct, secure line to book appointments or manage long-term condition reviews without waiting on hold at 8 a.m. And I think we've all been there, listening to the ghastly hold music, wondering when your call's going to get answered, etc. And how clinicians could actually communicate this to patients. And this is only, a very sort of rough example, but you'll get a direct link to your smartphone. You can book or review at a time that works for you, keeping our lines open for urgent care. And that should then hopefully eliminate the urgent calls and people waiting and getting aggravated trying to get through to their practitioner. Another area that's becoming increasingly popular, especially with the use of AI built into digital technology, is at-home smartphone diagnostic tools. And again, the pitfall here I found is relying on technical jargon, AI terminology, or regulatory detail. Now, my pass-along narrative would be to focus on the practical clinical value and patient convenience, such as a smartphone camera becomes a reliable clinical-grade testing tool patients can use at home. And how clinicians could communicate this to patients, instead of taking a morning off work to drop your sample off to the clinic, you can do this test in your own bathroom. It takes 3 minutes and the app will guide you step by step, and the results go straight into your medical record for me to review. Another area that I've worked in, and again, obviously, I do like to try and use real world evidence, evidence-based digital therapeutics. And again, this is becoming ever more increasingly popular. Again, the pitfall could be drowning clinicians in software architecture or complex therapeutic theory. My pass-along narrative would be position it as an immediate, accessible extension of frontline care. And how clinicians could communicate this to patients. This is a personalized, evidence-based digital program backed by clinical trials. It gives you 24/7 tools right on your phone while you wait for face-to-face appointments, or as a non-medical alternative to help manage your condition. And again, looking at sort of actions moving forwards that tech companies could take, try and replace legal speak with conversational trust statements. When addressing privacy, don't always quote ISO standards or regulations. Equip clinicians with direct answers like your data is held to the exact same security standards as your GP records, as your doctor records. It's never sold, shared, or used for advertising. Provide that how to explain this. So stop sending 40-page PDF or clinical white papers to busy clinical leads. Try and create a 1-page patient conversation guide and a 30-second script tailored for GPs, nurses, and admin staff that they can work with and tinker and change to suit them. Remember, these are just guides, so they don't have to stick to these scripts. It's just something to give them that extra support. And try to use peer-to-peer clinical champions. Clinicians don't always want to hear from tech marketeers about adoption. They want to hear from fellow doctors and nurses who have used the technology in busy clinical environments. Use case studies co-authored by frontline staff detailing how it solved a specific clinical or operational bottleneck. And I think my takeaway on this, Jose, would be that ultimately adoption doesn't happen when a procurement contract is signed. It more than likely happens when a doctor or nurse looks at a patient and says, I recommend you to use this. I think tech companies need to try and view clinicians not as end users, but as trusted ambassadors, and try to give them the narrative tools to advocate for technology at the bedside. And that's really my take on that, based on my experience of navigating around the NHS the last 10 to 15 years. You're on mute.
You know what I didn't hear in that? I didn't hear a single acronym. And I love that. I'm stealing that, by the way, pass along narrative. And we have time for one more. We're running. Let's see. I want to ask you one more question, Sarah.
Okay.
Can we do it on Can we do it on speed mode?
What, do you want me to talk quickly or do you want me to speed me up? I will try. I mean, you can stop me mid if you like. I won't be offended.
You know what? I'm going to save it for the after party.
Yep, that's fine. Yeah, of course.
And I'm going to do.
Sorry if I went on a bit too much there. I do apologize.
You know what? That was brilliant. No, that was brilliant. I loved that.
Thank you. It's I think experience is key, and I think for me, the way I am, I'm very patient centric, and it's the most important factor for me. It's patient care at the right time. Patient comes first. And that's always the way that I've been. So it's and being a patient myself, we're all patients, aren't we? We all have that experience. So being empathetic and understanding, and also trying to walk in the practitioner's shoes, because let's be honest, they have a really hard job, really, really hard job. So, my hat's off to all the GPs and practitioners on this call, because, yeah.
Do you remember I don't know if you were there, we did a webinar with the UKDHC, and they had a chairman who did a graph of where everybody stands in healthcare.
Yes, I remember. Yeah.
And he just said, we're all in there. We're all
Yeah.
in there.
Yeah, absolutely.
And so patients are us.
Absolutely.
I'm going to bring on our third speaker. Claire, you ready? Ready or not? Welcome, Claire.
Thanks.
And I've got and I met you a couple months ago. We did actually an event together, not in this series. We did actually one of my own webinars I do for myself, and on after cancer care. And the reason actually why I reached out to you, and I don't know if you remember this, Claire, it was actually something you posted. I was like, wow, she has amazing lexicon. I know you don't like, well, I know that's a weird word, but it's like your ability to create language, terms that I've never seen before, but I read it and I'm like, oh, okay, I know what she's saying, And I thought, oh, I gotta, and she's way better at this than I am, so I want to talk to her. But sorry, that's probably not a very good way of introducing you, Claire. You're a bridge person between healthcare, nonprofits, tech companies, patient advocacy groups, patients. How am I doing in terms of an introduction? Is that okay? Do you want to expand on that?
I'll add a couple of other things.
Yeah.
A little bit different than the other panelists here. My background's in the social sciences, so I'm a sociologist with an emphasis in human sexuality. And I've had background as well in organizational development and in tech innovation consulting. So I kind of walk in many worlds that are touching, but not necessarily overlapping all the time. And so the other piece that's probably pretty important for this conversation as well is that I'm a stage 4 cancer survivor. So I also have experience on being that side of the consulting table, if you will. So I'm bringing a lot of different perspectives.
And now a lot of people, there's two questions I want to ask you, and I want you to speak to the and they won't necessarily say this publicly, but like off camera, sometimes people will say things to me when the call's not recorded. And this is what I remember asking somebody, she was complaining about the way people talk to her. And I just said to her, do you ever feel insulted? And she broke out laughing. She goes, yep, all the time. And it's like I gave her permission in saying that. But I guess I needed to do that because I mostly work with tech companies. And she says, it's because they assume we don't know anything. And, or that people who work in a care home or a nursing facility don't know anything about AI. It's like, we've all been using ChatGPT for the past 2 years. So we don't talk to us as if we've never heard of it and don't have an opinion about it and need to be told. Obviously you know more about it than we do, but we know more about how we're using it. And this isn't our first rodeo. So that's something I really wanted to speak to you about is, and actually another thing that she brought up is, okay, your health tech company, you've been in business for a while, but you don't know how we do it. And so you're coming to assumptions. You're bringing assumptions into this conversation that you should have maybe not be bringing into. I mean, if you looked at our website, things like that, you don't. So yeah, you know things that we don't, but we know things you don't. So I think that's where the feeling of insult comes in. I don't want to be like pointing fingers and going, "Oh, it's their fault," but how do? And I want you to speak to the tech companies here.
Mm-hmm.
So they're coming into these conversations, and a lot of them know they need to improve their communication, and they want to. I wonder if you can give some tips.
Mm-hmm. Absolutely. One of the first things that tech companies need to recognize is that their consumers now are far more sophisticated than they were a couple of years ago when it comes to at least some type of experience with AI, an understanding of what's possible, what's available. And there are just richer conversations that are possible now, as opposed to, we're a tech company, we make a cool thing, you should use it. And that's not effective. The other thing tech companies need to recognize, and I really like to drive this point home as a social scientist, is that technical expertise, so understanding the tech specs and what the app can do or what the AI is capable of and how to build that out, is very different than having contextual expertise, is very different than understanding the context that clinicians are working inside of, the context of a patient's lived experience. And so this is incredibly important. So to that end, I feel humility, especially now when we're in the wild, wild west of AI development. I'm here in the San Francisco Bay Area. I'm every day bombarded by the way tech companies are very, very proud of what they're creating, even when the tech companies themselves aren't fully aware of the direction we're going in. We're in a supersonic starship headed out into outer space, but we don't exactly know what direction at the moment. It's being developed as we go. And that's why we can't lose sight of the human, not just the human side, but the humanity and humanitarian side, that any sort of trust is really built on relationships. And if we're like a rodeo, just trust me, come on, hop on the bandwagon, that doesn't work. It's not going to work, and it could potentially lead to the demise of all that we know and hold dear. So that's why I take this topic very seriously, is where can the relationships be re-emphasized? And I'm also wondering, you mentioned acronyms and moving away from them, but I'm going to throw out some acronyms that most everyone here is probably familiar with. We definitely have heard of, CYA, so cover your ass. And then we've heard of KYC, so know your client. And usually KYC is in the sense of looking for bad actors and trying to avoid corruption in the systems, if you will. I want to propose, what about reverse KYC? This reverse know your client that tech companies need to do. I'm sometimes wondering, I do a lot of ethnography when it comes to tech projects, and I'm wondering if AI companies are doing enough of that. And what ethnography is about is actually sitting with your customer, your future customer, who you're building for, who you're solving for, and understanding from them themselves. What is the problem that needs solving? What's the context you're existing within? And then what are the possible benefits you need solved for? What are we solving for here? And then what are the risks? And collaboratively looking at that so that what's actually being built in terms of tech and AI is actually useful to the end users.
I like that. I actually do something sometimes, not with another domain. I won't go into the specifics. Is I'll interview oncologists mm-hmm. and not mention the product mm-hmm. at all, but mention the domain and encourage them to complain about it, mm-hmm. about how they're being sold to and how companies are presenting themselves. And people, it's not hard to get people to complain, and then I just soak it all up. And then you come back. Mm-hmm. I think it's a bit difficult because, Yeah, if you built a company, you've got this baby and you want to show everybody the baby,
Mm-hmm, mm-hmm,
and but sometimes you have to talk to them without the baby,
mm-hmm,
and it's a different conversation. I got another question for you, Claire. This isn't about me. This is about picking your brains.
mm-hmm.
And actually, this is going to be like this is the what do I say to my patients question. And I think and you can narrow scope on this
Mm-hmm.
in terms of like the domains. I know you work in a lot in the after cancer care
Mm-hmm.
domain, and I know you probably have other domains too you work in. But in that space, what do people need to say? Like if an oncologist or somebody in your space is using a new technology,
Mm-hmm.
um, what does it? What should the tech companies be doing from a communicate in terms of pass along narrative? And Sarah just spoke to this.
Mm-hmm.
Is this how important a priority should this be for them? I know a lot of them are nervous about it.
A lot of the tech companies, you're
Yeah,
saying? Mm-hmm. And
yeah.
what's your sense of what they're nervous about?
Um, Making a claim
Mm-hmm.
that and well, actually, I'm going to back up a bit because I'll tell you why. Because 18 months ago, it was about CYA.
Mm-hmm.
That's what it all was. 18 months ago, if I was doing an event like this, all it was is it GDPR compliant? Where is the data saved? Is it secure? And that was drilled into them. So now it's almost like a gag reflex, you know. So it isn't that they're bad, but they're fighting the battle they were fighting 18 months ago, you know. And they're still, but now it's kind of like the map has changed, and they're still talking to people in ways that help them navigate those conversations a year ago.
Mm-hmm.
So they're um, they're almost like, oh, this would have gotten me into trouble a year ago if I spoke like this. So that's why I'm reticent to go off piste.
Mm-hmm.
But now they're kind of almost expected to sometimes.
Mm-hmm.
And maybe I'm asking you the wrong question, but is this something, assuming they can get the legal, it's not a legal problem,
Mm-hmm.
how how big a priority should it be for them? Pass along narratives.
Yeah, well, I feel that it's at the caliber of very extremely important. Absolutely. And so with tech companies, there's a lot of resource spent on building out the tech team, the scientists, the engineers, if we want to call it the left brain side, kind of the hard science. And that's incredibly important. And then next tacked on is the sales and marketing, the comms. So they want to be sure to be communicating the value from a sales and marketing to address the bottom line. And that's important also. But what I see missing is really the soft skills. And the soft skills being listening, being curious, inviting into conversation, inviting into collaboration. And I don't see enough of that going on. I don't see enough of tech companies, just from my limited vantage point over here, I don't see enough of tech companies going in with curiosity before they're trying to demonstrate capability and impress the client. And the client isn't yet at a place, the client being a hospital system in this case, or clinicians, that's not the world they're existing in, but they are existing in the world of relationships. And so trust, if we're talking about trust, is really only built inside of respectful relationships. So I don't see tech companies or other companies in other sectors, not just tech, bringing in enough consistent respect. And I can only speak from the United States, the perspective of the culture I'm living in. I don't want to make accusations beyond that, but this is more what I'm seeing. And it is absolutely important that tech companies, those developing the technology, the software, the app, be involved in creating the carry through narrative alongside those who are existing in the context.
You could say the same thing. Everything you just said is applicable in Europe too,
Mm.
even though the vibe's different.
Mm.
Um, Sir, do you mind if I put you on the bench for a minute?
All good.
I'm going to bring on our fourth speaker, and then I'm going to bring all the speakers on. Thank you. Kofi, ready or not? I
Hello,
don't know if we've
hello.
ever had you on this series before, Kofi.
I don't
Have
think
we?
so. No, I don't
You
think
know what?
so.
I've
I've
quoted
been
you
watching
about
from
a
the
dozen
sideline.
times, and I
Thank you.
haven't always credited you. I've quoted you a lot, and I remember when I first started getting into storytelling, communication, trust. I think we started. It was about 2 years ago. We started talking, and I've posted a lot of those clips.
Yeah, yeah.
Kofi's
Thank you.
a marketing person just like me, but he's kind of on the other side of the fence. And I think what you described was, Jose, you're before the spreadsheet. I'm after the spreadsheet.
Indeed, indeed, indeed. I'm about how is what we're doing driving that visibility, that engagement, and ultimately the sales, right? So yes, a company might have a great product or service to offer. They've done all the work to kind of line all the, at least, as much as they can to line all the ducks in a row as far as like the talking scripts and what they're going to do and all those kinds of things. But yeah, my role is really in bridging that gap between what they have and the people that they want to, that they want to adopt and or use that product or service. So yeah,
I rewatched this famous clip, and I'm not one of these Steve Jobs worshippers, but I love this clip. Steve Jobs, 1996. He's he's back at Apple. Remember, he got booted out. He came back,
hmm yeah,
and one of the engineers said, "How come you're not selling OpenDoc?" I don't even know what OpenDocs is. What are you doing with Java? You know, and Steve Jobs basically replied, "Well, this era of you building things and telling marketing, okay, why aren't you selling this harder, is over. We're actually starting with the customer, and then we're going to tell you, the engineers, what to build and incorporate that." And that's what happened
yeah,
in the late 90s. But it seems like with AI, that's flipped, where engineering is running ahead and marketing is like, oh, we've been given this thing to sell and
yeah,
no one's asked us. And then
yeah.
no
I
one's
mean that I've been around long enough to see the different iterations of that, both like towards the back end of the web becoming a thing, right? It's like everyone's like, put me on the web, and it became PDFs, those kinds of things, mobile, social, and then obviously AI. And so I've seen that pattern happen a lot, right? Where the people that are closest to the technologies are so enamored by what it could do and what it could bring. And again, I think you or some of the other panelists mentioned this, that like it's so excited about getting it out into the world and telling everybody else what it is, but they lose sight of the usage and the context to which it'll be used in. Not everybody wants to know, and to going harking back to Steve Jobs context, is that not everybody wants to know about the bits and bytes and in the case of AI, skills and agents, and that's gibberish to most people. And I'm talking about most people, right? When you're in the ecosystem, you think that everybody understands what a skill is and what an agent is. But as I've spent more time IRL in real life with people who run actual businesses, in hospitals or facilities, it's all gibberish to them. All their question is, how can it help me do what I need to do or serve my patients and my constituents or my clients better? And that's all they need. So yes, I feel like we're at a point now with AI where it is starting to shift. The As you mentioned, the health health tech companies are starting to get kind of a little bit of pushback, really, right? Like where those sound bites about data and are not really resonating as they should. And so now I imagine that going forward, it started happening going forward. It is going to be about the context. It is going to be about um, what I call kind of like the three I's of trust building, which is the information, which is, where we all start, which is, how do we get attention? Tell us what our the unique value proposition is of our product, those kinds of things. There's also the implementation, right, which really is about providing context. I think Claire mentioned this around context around, okay, so how does that work within the situation of a dental practice or a healthcare system or whoever you're communicating with? So what are the proof points that makes me believe that what you're bringing to the table will make my engagement with my patients or my constituents better. And then what's always missing is the interaction, right? So information, what you're talking about, the implementations, kind of the proof points, but then also those interactions, those actual human experiences. So how are you making them feel? And when you come from technology, you tend to dismiss the 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 emotional, the connection, the relationship part of the person sitting across from your the table from you, if it's in a sales conversation, and then also going down to the patient, you tend to like downplay that. But we're at a stage now where that is taking priority. Again, harkening back to what you talked about, Steve Jobs, that it is really about the value that it's adding within the context that is going to be used versus how the tool, what the tool is.
You know what? That last piece seems, and this is what I say to people all the time, and it's kind of a weird. I'm not as articulated as you are. People say, "Oh, how do I build trust? What do I use?" And I just say to people, "What are you doing with them? Doing things together. The things that you do together with them, that's where the trust is made. It's not in a piece of information that you push out. It's not in a communication. That's all a prelude to that third eye where you're interacting with them, and that's where the trust is made.
Yeah.
You don't get there without the communication. But that seems to be, and you're right, that's like that's where a lot of people drop off.
Mm-hmm.
It's like, okay, we just get them to that point, and then that'll be sorted out somehow. But
I mean, the reality is that at this stage, even within the context of health AI, there are multiple choices. I was speaking to a senior care facility recently, and she, not specifically about AI, but just a kind of like how they're getting more residents in the door. And we gravitated towards AI and kind of because we're talking about processes, and she was saying she gets 5 to 10 inbound emails about how AI is going to help them a day, right? So, from the buyer perspective, they have a lot of choices. Now, one of the choices is also none, right? So it's like it's your competitor or nothing, right? So there's that. So I think health tech companies need to realize that as much as you feel like you're bringing something new to the table, particularly in the context of AI, people have heard the sound bites already. So you have to assume, and you could kind of, what I talk to a lot of health tech companies about, and I help them with is like sometimes preload that, right? You can send that. I mean, you can send the one sheet up ahead and say, in advance of the sales meeting, right? Like they have, they have the context already. But when you're in that sales conversation or adoption conversation, it is about that implementation, like those proof points, emphasizing it within the context of what you would expect that they were using it. But then also, again, that interaction. How are you supporting the practitioners who might be the ones using the technology, right? Because if you're talking to the owner, they're also thinking, well, that's all great. It can do, let's just say, transcribe doctor's notes. It can transcribe the doctor's notes. But then what does that mean for my front desk team, right? Now they have to learn something new, or, so being aware of how you're not just they're not just buying something, a subscription off the shelf, but really they want you to be a partner to their adoption. And those who are able to do that build the trust and then also become, it drives sales for the company.
We're going to group hug, Kofi. You don't have to, I'm keeping you on the screen. And, we've had a lot of questions here from the audience. And let me go back. And thank you so much, guys, by the way, for coming to this. And I'm going to read off of you. Ideally, AI should give clinicians more time for the human side of care, not less. Automate the repetitive work, improve the information and decision, and let the clinician focus on listening, empathy, judgment, and helping the patient get better. Let's see. Unfortunately, AI adds a minimum of work steps to a clinician's workflow. Did the clinician use it? Why or why not? Did they disagree or take the output? Why or why not? That's those are comments. And I wonder actually, have we and we're going to start, by the way, we're going to start the after party in 9 minutes. And I know some people here are watching on LinkedIn Live. And then some people are on Zoom. If you're on LinkedIn Live and you want to take part in the after party, that's where you can kind of raise your hand and come forward and speak. You have to join us on Zoom. There's a link in the comments because the after party is not going to be broadcast onto LinkedIn Live. And so feel free to hit that link, click on that link, join us on Zoom. The LinkedIn Live is going to continue for another 8 minutes. There's a question I didn't ask Sarah, and I'm going to bring it up. And I still want to ask about this. We've talked about pass along narratives, and there's two big areas that I'd like to focus on. One is the pass along narratives, which we talked quite a bit about. And I thank you for giving me that term, Sarah. I'm going to use that all the time now. But there's the other one is the listening piece and the curiosity. And how could people make this part of their marketing? Not just when things go wrong and we have to. I mean, I tell people it's important and everyone agrees. And then what happens is nothing. Well, it tends to just drop off. That sounds like a good thing. It doesn't become part of a process. It doesn't become methodical, consistent. I don't know if you could speak to this, Marcus. And forget AI, forget technology. How does a company make research a methodical, systematic, regular part of their sales and marketing? Not just something they resort to when it is an emergency, something they do continuously.
Yeah, if they're doing it for an emergency, then that's a problem. I mean, they should be doing it prospectively as they're developing their business strategies and their business strategy leading to their marketing strategies. And again, marketing isn't just about the promotional aspects. It's integrated in with decisions around the product, how it's priced, how it's positioned, all those elements of marketing that are very fundamental. So the research has got to come in the frontward, and it isn't it isn't just a one-time thing. It's a continual thing that you need to be doing. So if they're not doing that, then they need to start.
I wonder, and I actually I find a very simple way to slip it in, but in all my conversations, I just ask a research question in in all my meetings, so I know I'm always doing it. But I wonder if we could speak to marketing involves knowing the industry, not just marketing data, but what the industry topic subject is about from Tanya. And trust must be implicit, not explicit. As soon as you start saying trust us, you are putting a big target on your back. Any failure that happens will kill you. Should be something people say about you, not what you claim about yourself. That's from John Paul. And there's another comment here from John Paul. By the way, if everybody in the audience has a question, help me out here. Put a question in the chat. A lot of these are comments, and those are welcome. And give me a question I can cover. I never heard of. Interesting global dialogue on AI agents from the legal profession steps forward on agentic AI governance. Sikor's AI starting in life sciences, health, and care, supported by law tech. Their need to as always be layered communication. Saying I mean the service providers need to have fair terms and conditions. There must be very few Cambridge Analytica moments. Healthcare professionals need to own the communication. IT vendors do not normally have enough ethical medical debate experience. So I think actually this is Frederick pushing back on me. And maybe I was barking up the wrong tree. It sounds like I was.
Well, actually, so I have a lens on that. So I've done a lot of earlier in my career, I was doing just working within the marketing, creating materials, the assets, those kinds of things. And then we would the process was, and then you pass it off to the sales teams, and the sales teams go out and sell, but it wasn't working, right? Like they were in the sales numbers X, Y, and Z. But the more I got involved in the sales aspect of it, I realized that it was because the sales teams were going with, again, more product focused messaging and communication, and not service as far as relationship building messaging and communication, right? And once we first of all, make sure that the marketing and sales were working closer together, and marketing was training sales how to have those conversations, because marketing does a lot of times own the research, understands the ICP, they've done the empathy maps, they've done the customer journeys, like those kinds of things, right? So they own a lot of, so they have those assets to give. But as the salespeople started coming back and giving marketing the context around some of their objections and stuff like that, we realized that there was a broader need. The clinicians were asking for more participation. Now, it's not about making the decision for the clinician, right? But enabling them with tools. In some cases, is as simple as a literal brochure that you print out, right? That you can hand off to the patient. In other cases, it might be a gap in the delivery that the clinician's looking at. That yes, it's not your core product, but it would accelerate the clinician being able to use that product, right? So I think that the health tech companies do play a part in the clinicians, let's just say, adoption and usage in service of the patient. But so having those channels open always helps, right? Being willing to step in where possible, or even where you don't have the expertise and you can't make certain claims, but can you point them in certain direction? So that helps both the product sales, but then also it helps the clinician, because clinicians aren't out there looking for all the solutions, particularly from the technology perspective. So I think it is a balance, but not overstepping that balance. But most health tech companies don't have those channels of communications from clinician to sales to marketing open at all, right? So at the very least, start that.
I got one technical question about trust. This is from Olivier in the chat, and Sarah, I'm going to put this to you, and this is a thorny one.
Oh, good.
We currently see in England and France and UK a lot of data leaks sold on the dark web. Question: how do you ensure any patient data doesn't leak? Or what do you do when it does? This is a question that we're going to get more and more of.
Yeah. Yeah.
And this is part of the baggage.
Yeah, it's a tough one, and I think it's not just health tech industries. I think this hits all industries. And I think when I've been working with NHS bodies, and I've worked directly with the NHS as well, not just the tech companies, so I've been fully ingrained in the infrastructure of healthcare. I think one of the key things is really trying to only collect and store the patient data that's generally needed. And we always try to remove or anonymize any personal identifiers wherever possible. Have strong access controls as well. So enforce multi-factor authentication, use role-based access so staff can only see the records required for their job. And we've had a few cases actually in NHS England where people were viewing records that they shouldn't have been, and now it's gone to courts. So it's very, very serious. Encryption, protect backups, the normal stuff, and also adhere to compliance and governance depending on where you are. So in the UK, I'm trying to remember, we follow GDPR, UK GDPR, NHS security standards where applicable, and do regular penetration testing and things like that. I do know that France and the UK, there was a lot of instances where patient records were appearing for sale on dark web marketplaces. And these were coming from phishing attacks to healthcare staff, ransomware, and compromised third-party suppliers. So I think really it's just to have zero trust security model combined with encryption, identity protection, and continuous monitoring and training, and really keep your staff up to date, and keep what you use to the minimum. And be honest and open about it as well. You have to be honest and open about data leaks. So yeah, that would be my experience, and it's ever evolving, ever changing, and the bad people are ever evolving, ever changing. They're getting more sophisticated, especially with the use now with quantum computing. It's in the next 10 years things are going to change dramatically. Size of our passwords, if you look at that, it's gone from being we could get away with maybe 4. A lot of people use the name of their favorite pets, which was a very silly thing to do, but now companies require a minimum of 12 to 13 with special characters, changing them every month. So I think it's just equipping staff with the right levels of knowledge and being open and honest as well about if things do go wrong, which is a legal requirement, by the way, in the UK. I hope that answers. It is quite a sticky area, isn't it?
Well, we're gonna go to the after party now. So I'm saying goodbye to YouTube and to the replay. We're gonna cut the event there. But I don't want to not say goodbye to the speakers or the audience here. Thank you. And now